Okay, well, we've got a full schedule for today's call, so we'll go ahead and get started. And you might hear some people joining us in the background. So welcome, everybody. Good afternoon, and thanks so much for joining us for today's community conversation. This is our second conversation in our series, so if you were able to join us for our first one, that was just a general overview of COVID-19, and that conversation happened about mid-April. So we're excited today to be talking about building healthy workplaces as we transition back into the workplace during COVID-19. So today we're going to be learning a little bit about the American Heart Association's response to COVID-19. We'll be receiving some tips, strategies, and resources to help support health and wellness as the community slowly re-enters the workforce over the next few months. And we're going to hear from a panel of local experts on supporting workplaces during these ever-changing times. So a reminder, if you weren't able to join us for the last community conversation, we will be utilizing the chat feature in today's Zoom webinar. So we'll have a question and answer session towards the end of today's call. And so if you have any questions as we go through today's panel, please feel free to put those in the chat box, and then we'll address those during the Q&A session. So with that, I will introduce our panelists for today. So our panelists today, thank you guys so much for joining us. We know that this is a really busy time, and we just appreciate you guys taking time out of your schedule to join us. So first we have Karen Harbin. Karen is the president and CEO of Commonwealth Credit Union. Karen, thanks so much for joining us. Next, we have Krinda Franke. Krinda is the president and CEO of ExecuTrain in Lexington. Krinda, thanks so much for joining us.
You're welcome. Hi, everybody.
Thanks, Krinda. Next, we have Dr. Mark Greer. He is the medical director of Bechtel BGCAPP, and he's also the Central Kentucky American Heart Association board president. So thanks, Dr. Greer, for joining us.
Thank you for having me, and thank you all for joining.
Absolutely. And last but not least, we have Adam Simpson. Adam works for the American Heart Association as a business development manager in our workplace health solutions team. So thanks so much, Adam, for joining us today.
Absolutely. Thank you for having me.
Of course. So with that, we'll go ahead and get started with our panel. Just a reminder, if you have any questions, please feel free to put them in the chat box. So our first question today is for Dr. Greer. Dr. Greer, can you tell us a little bit about the latest of Governor Beshear's recommendations for reopening businesses in Kentucky?
Yeah, absolutely. So anytime I talk, obviously throughout my disclaimers, this is just my opinion, not that of the Heart Association and my employment or the government or yada, yada, yada. So, and I have no financial disclosures. Recently, the governor has released 10 rules of reopening a business under a healthy at work plan. These are comparable to what President Trump has put out through the White House and the CDC guidance. And so there's 10 of those, and I'll go through these 10 just kind of as an overview. One, we should continue to telework where possible. Two, there is a phased return to work plan that he's put into place and that's recommended. We need to work through those. Three, have on-site temperature and health checks available if possible. Number four, we should continue to use the universal masking requirements, recommendations, and any other necessary PPE, such as gloves, gowns, whatever is appropriate for your business, plexiglass shields, etc. The next one is really to close these common areas to prevent that co-mingling where you could actually spread the disease process. The next one is to continue to enforce your social distancing. The next will be to limit face-to-face meetings, maintaining that social distancing as well as maintaining group size. So this is where teleworking, et cetera, comes in. Also to make sure that you have sanitizer, hand wash stations available. And very importantly, is special accommodations for those who are with comorbid diseases at higher risk, those that are elderly, and those who are either exposed, potentially exposed, or taking care of those ill those who may be ill at home. And then finally, the 10th one is to have really a testing plan in place. How are you going to manage these potential exposures and get them tested for whatever tests are available in the community? Some of this information is found at www.thereisafuture.org. Also, definitely go to heart.org. That's probably the most important one to go to. And then there's also other sites like Team Kentucky Labor Cabinet, CDC Interim Guidance for Business, etc. That's it, Natalie.
That's great. Thank you, Dr. Greer. Next question we have is for Karen. So Karen, can you tell us a little bit about the steps that you all plan to take at Commonwealth Credit Union to reduce the transmission among your employees?
Sure, thanks, Natalie. You know, starting about mid-March, we knew we were an essential business, and we took the steps that were needed to continue providing services to our members. And by doing that, although we are an essential business, we had to close our lobbies, but we continued with our drive-thrus, our live video tellers, and of course our call center, which has at least doubled in volume since the pandemic happened in mid-March. But we had people that were affected by childcare and that were self-quarantining. So we had those people at home, and we also had about 50% of our workforce that we got remote to work during this time. So that helped a whole lot. And then the people that were left in the office, we made sure they were social distancing. So we had different work areas that we set up for those people. We made sure that we had all the proper equipment that they needed, such as wipes and Lysol, and just encouraged all kinds of safety precautions such as that. We had a couple of employees that we had go home and just sew masks for team members because we could not buy masks. We've since been able to order all the proper equipment that are needed, and we'll be using those when we come back in our phased reopening strategy. We have gone to all WebEx meetings and stopped the training of employees except for if we're doing it remotely or through WebEx. And of course, there's no travel that our employees are on. And we know that there's a tremendous amount of stress. So we've actually offered mental health days. Each of our employees gets a mental health day that is not their PTO for both the months of April and May, because we know that physically and mentally we have to take care of our employees because they are our most important asset.
That's great. That's a great idea to allow your employees to take a mental health day. That's something that I think a lot of businesses could utilize moving forward in COVID-19. So thank you, Karen. Dr. Greer, how can businesses work to identify where and how workers might be exposed to COVID-19 in the workplace? And then how should businesses handle a sick employee during COVID-19?
Yeah, so two good questions. Really, in our current environment now, and as we start to ramp up and we phase back to work, we really need to look at every step and interaction an employee might have, not only with fellow employees, management, et cetera, but potentially clients that come and visit our place of work. It does help to have an expert to kind of talk through these fields, talk through these issues. Typically, like in occupational medicine in my environment, we have not only the medical training, the medical clinical aspect of it, but we also have a lot of the regulatory requirements that's put out by the CDC or by other regulatory agencies, as well as we have a good approach for medical legal discussions, whether it's EEOC or ADA, EEOC being Equal Employment Opportunity Commission and the ADA being American Disabilities Act. So there's a vast variety of businesses. Some are coming from a completely closed status, those who may be partially at work doing a lot of telemedicine work, or those who are really in essence essential organizations that are still, for the most part, fully at work to maintain minimum staffing, fully at work to maintain essential operations. Everyone needs to really familiarize themselves with the various requirements that is out there. Requirements by the state of Kentucky, which is probably the most legal mandating component, as well as the guidance put out by the White House or the CDC. And regardless of the political environment, each one of these issues need to be looked at, and from a business standpoint, kind of really compare and contrast risk versus reward, and what is the business able to manage at the time. A lot of information is found on Kentucky COVID-19, as well as the CDC websites. I recommend everybody to look at these, break them out in small, digestible bits to avoid getting overwhelmed, as well as to send that out to your employees. And small committees to work through these issues, whether it's the top manager that's ultimately making the decision, or the risk-reward decision, to absolutely in essence, and I don't mean this negatively, but those who are really on the front lines that are manning the counters, cleaning, etc. Having somebody from each one of these organizations, if possible, can really talk through the issues from their aspect. So at management level, you might not understand what the person's doing really at the counter level, and they can give you insight to help protect themselves as well as your clients. So if you have somebody who's sick or potentially is sick, as Karen was talking about, there's a number of different things that you can do. One is obviously to set up a good home surveillance program for those employees. Educate them so that they know what they should be looking for, and if they do, they should be able to call their supervisor and stay home. But in essence, what everybody's saying, out of an overabundance of caution. Having flexible sick leave, supportive policies for those who may be ill, who are caring for ill, or even may have children who, they don't have any way to have them taken care of while they're gone. Anybody who is sick or starting to appear sick, you need to have this ability for them to, when they're at work, to say, hey, I'm not feeling well, I'm starting to feel feverish or whatever, separate them out from the community and allow them to go home, and have policies in place to support those decisions. And then obviously if an employee is confirmed, it's important for management to know. They need to make sure that their staff has the understanding that we might have a potential exposure, but you also have to be careful that you maintain confidentiality of that employee who might be ill, and that is required by the Americans with Disabilities Act.
That's great. Thank you, Dr. Greer. Corinda, the next question is to you to follow up on that. So Dr. Greer mentioned creating policies that could help support some of the recommendations that we have in place for COVID-19 in the workplace. So can you tell us a little bit about how businesses could work to establish policies and practices for things like social distancing?
Sure. Well, first of all, I'm that person that I really like my own space. So there's a part of me, there's a side of me that's kind of happy about this social distancing when we go back, start to phase in. I'm the person that, the revolving doors, I want my own wedge. If somebody gets in that wedge with me, I'm like, get your own wedge, stay away, So there's some things that'll be put into place that I think probably stay, maybe forever or for the unforeseeable future. So I'm all about that, but and it kind of depends. So a business like mine, I'm not completely dependent upon foot traffic because like Karen alluded to, we can do a lot of our training and have been for a couple of years in a virtual modality. So people can be at their house, they can be at their work, they can be in their office, they can be wherever they want to be. They can be on the beach, doesn't matter. So then we have a lot of online training. So we're probably not going to open our doors to foot traffic probably until June or July. And then we'll look at things like our classrooms that hold 12 and 14. We'll probably cut that schedule back to 6. So we have plenty of space to put people in. And I think sometimes it really comes down to, I hate to say common sense, but really as a business owner, look at your overall day-to-day operations. Where do people congregate? Where do customers congregate? So we've got to figure out ways to minimize that congregation, copy machines, coffee machines, things like that. Do we remove coffee for a while? Is there a policy on that? As employees and as citizens, we also have to take onus of our own well-being, right? So if I'm going to go into my workplace and I'm going to use a copy machine, my computer, my keyboard, the front door, I'm going to clean it before and I'm going to be respectful and I'm going to clean it after. Just like at gyms. I mean, it's almost bringing to the forefront, and you've heard lots of people say this, why weren't we doing this before, right? So if I go into a gym, I always clean any equipment I use before I get on it, and then I clean it when I get off. So I think if businesses can help their customers understand what they expect of them while they're in their business place, if I'm going to a hair salon, which I cannot wait for those to open up. Don't even touch my hair against my profile picture because this is self-maintenance right here for a couple months, right? But I want my hair salon to make it very clear by the postings what they expect of me. I don't want to break a rule, and I don't want to get the death stare from other patrons because I've gone down a one-way aisle the wrong way because it wasn't clearly marked, right? So I don't need to jump around. I think there's there's things to look at on both sides. How, as a business owner, I want to take care of my employees that are coming in. Am I going to stagger work days? Am I going to have shortened work weeks? Am I going to have people work different hours? So I'm going to take care of them. I'm going to look at places they congregate and common areas that they use, but as well as my customers coming in the door, and then clearly mark for everyone, again, the expectation of how you should be utilizing those facilities and the services during that time. Stay in your own wedge, please. I'm nervous.
Stay in your own wedge. I like that. That's great. Thank you, Corinda.
You're welcome.
Karen, this next question's for you. So can you tell us a little bit about how you all at Commonwealth Credit Union are educating your employees about reducing the spread of COVID-19?
Sure. So we are really, really big on communication at the credit union, and I feel do a really good job of it anyway, but we have stepped up our communication even more during this time because we've got remote workers, we've got people that are in areas that they're not normally working. So we felt the need to do that. And we are using video messages a lot. Myself and others are doing videos to communicate what's going on. We have done actual social distancing demonstrations where people stand 6 feet apart, stretch out their hands, and it really helped in the beginning because I don't think people realize how far away 6 feet is. They think they're 6 feet away and they're really not. So we've used that, a lot of video chat, and like I said before, training and things done through WebEx. We email, but emails can sometimes get lost, so we don't do as much of that possibly. And then we every morning my senior team has an 8:15 call, and we discuss what's going on from the night before, critical issues with staffing and things like that. And then the chief officers take that information back to their managers, and then the managers down the line to the staff. So that's really helped. We also have messaging boards internally, and we put a lot of things up on those, and they're in our hallways, break rooms, which we have social distance, the chairs and things in there, but people still go in there to get coffee and things like that. So we've done that. And then we are really concentrating on when we communicate that our why has not changed. It's just how we are doing things. So I think if people understand the why we have to do things differently, they're more apt to buy in and understand it and accept it.
Yeah, that's great. Thanks so much, Karen. Corinda, this next question's for you. As you mentioned, there's travel advisories and recommendations on the size of meetings and gatherings right now. How can businesses adhere to these guidelines, and what platforms would you recommend that they use to help support their businesses during this time?
Okay, thanks. Well, first of all, we took a workforce that by and large really wasn't used to working remotely, and we just dumped them out and we put them upside down, and we sent all the kids home with them, and then we can't leave really, basically, and we thought it would be easy. And I don't know about you guys and your businesses, but it's been challenging, right? People were not just born knowing how to do a virtual meeting, how to either run it or participate in it. So I think there's been a lot of challenge for the workplace to just keep doing business as usual. It's a paradigm shift of epic proportion. There are all kinds of platforms out there, and you guys probably have already been using many of them right now. We actually train on most every platform. We're vendor agnostic, but there's things like Zoom, as you know, that are very good for virtual meetings. And then there's other platforms like within the Microsoft Office 365 package, there's something called Planner, and maybe you guys are using that, but if you're not, it's a product or an application actually that is a mini project management. So you don't have to be really good at something like Microsoft Project. You don't have to be a project manager per se, but it allows you to put different, so here's an example. I was talking to Keith Yarber. He said, I want to put all these different projects that we've got going on, and I want to be able to put them somewhere we can collaborate. I want to be able to add people to add input, add files to that particular project, see how it's progressing on a timeline. But this is my entire organization and I don't have a lot of time to get them fully trained to be project managers. So something like Microsoft Planner was a good option for them. And I think it's important to look at what you already have available, what kind of IT staff you have to support those applications, and user adoption. Those are all really, really important. We've done a lot of training on Zoom meetings, not only how to lead a Zoom meeting, but also how to participate effectively in a Zoom meeting. So again, there's things like Slack and GoToMeeting. There's freeconferencecall.com that has video conferencing in it as well, that up to a certain time limit, it is free and performs very well. So there's a lot of packages and applications that can really help support your business and try to bring that collaboration and file sharing and brainstorming and try to keep things going as much as you can and keep people engaged.
Thanks, Krinda. Dr. Greer, how can businesses work to maintain and create healthy work environments during this time? Specifically, can you tell us a little bit about some engineering controls, PPE, respiratory etiquette, things like that?
Absolutely. Well, I think Karen and Krinda both did a great job of pointing out different aspects that's important for everybody to know. And so I'll kind of start with, education, like Karen was saying, is absolutely important. Making sure that management, as well as the employees and people visiting your site, have some form of education, understand why you're doing what you're doing. It's easier for them to adopt some of these methods and understand why they are and accept them, as opposed to it just in essence kind of being forced down their throat. So I greatly appreciate what they've said before. So to name a few, there's a vast majority of things that we could talk about on how businesses can maintain a healthy status of operations environments, including various type of controls, whether it's engineering, PPE, et cetera. So I'll kind of go through those. Again, just like I've talked with before, individual committees who are responsible for really protection of the workforce and their understanding of the requirements, assessment of your essential functions, and really, once you know what these essential functions are, being able to ebb and flow and be prepared to change your practices as needed. We do know there's always a potential for recurrence or resurgence and going back into more of a lockdown state or completely getting out of it. We know the future has changed and it always will be changed. So work on those practices, lessons learned, issues that you've had, and further develop those for the future. Writing these policies and practices out for social distancing and protection is important as well. They don't have to be super complex necessarily. They can be very simple for the smaller organizations. Obviously, when you get into larger organizations, then they really kind of take a life of their own. So understand that. And specifically talking about engineering, PPE, et cetera. In the future, there are things that you can do to improve the engineering status, and that's, with your HVAC systems, with sanitation of air that's going through there, filtering system, UV lights, et cetera. I think all of these are going to really take off now in the future. Some companies are already doing that where they UV their airflow, and they have certain types of HVAC systems in them that can manage any type of particles or infectious diseases, et cetera. Other things that we already know about is the PPE that we have, the requirement to wear masks. So making masks available for the employees and visitors to your site is a great idea, but also explaining what does that really mean? Because there's a vast majority of information out there that sometimes is confusing. What is a cloth mask over your face as opposed to a surgical mask, as opposed to what you hear, the N95s, P100s, PAPRs? I could go on for hours talking about the different types of respiratory protection that's out there. And I think there's a lot of misinformation. So finding some good basic information to give to people as to what the purpose is of that PPE and how it does affect you or affects the other people is important. And then there's also, like the other panel members have talked about, different administrative controls that businesses can take care of. Obviously, teleworking, staggering your work, having people come in at different times, different shifts, maintaining your social distancing, teleworking, et cetera. All of these are different things that businesses can do and be creative with, as well as be able to maintain, obviously, their operations and their business mission. And then again, stuff that we should have been doing all along and that we all have known about, but we haven't done it until now, is respiratory etiquette, covering your cough, hand hygiene, washing your hands, keeping your desk work clean, making that equipment available, giving responsibility to the employee to understand to clean their location, as well as if they're hot seating with other people, to clean it not only for themselves, like I believe Karen was talking about when she works out, or Creighton, I'm sorry, I can't remember who talked about this. Clean before you work out, oh, perfect. Clean before you work out, and then clean after you work out. These are things that we should have been doing, and these are things that we should continue to do in the future. And then when it comes to environmental cleaning and disinfection, this is something that everybody needs to be involved in. It's not back to the old routine, well, somebody else is going to take care of that. They're going to manage it. No, I'm going to manage my own personal space. I'm going to take responsibility for my own health care, for my own health, and for my own actions. And, unfortunately, sometimes that personal accountability is not always seen. And as businesses, I think we should go back to that and recommend that and enforce that.
That's great. Thank you, Dr. Greer. So we're going to switch gears a little bit, and we're going to hear from Adam Simpson with the American Heart Association. So Adam, first question I have for you, can you tell us a little bit about how the American Heart Association has responded to COVID-19?
Yes, absolutely. But the short answer, a lot. So a lot of organizations are. A lot of has already been discussed by other panelists. But some major things that I'd really like to highlight, and I'm actually just personally proud of being a part of the organization, are hosting things like this, having community conversations, pulling in experts from the local markets. I sit in Chicago, so I'm not in the Kentucky area, but I do cover our Midwest and our Western states. And I've seen this in multiple states across the regions I cover. And it's wonderful to hear just experts like the panelists we have here talking about how they're doing and getting everyone back in, how they're responding. So, real life examples go a long way. So thank you all for joining us and doing everything that you do and taking time out of your day to do that. I think that to me is personally one of the biggest things. On top of that, AHA is known as a leader in science and research, for cardiovascular disease and stroke. We're doing a number of things to kind of fast track some of these research and data pieces that we have. We had $2.5 million that we're fast tracking to go and look into the impact of cardiovascular disease or impact of coronavirus on cardiovascular disease. I'm sure we're all aware or have heard that there's been a big decline in the amount of ER and hospital calls for heart attacks, cardiovascular disease, stroke, things like that. And I'm sure we're all pretty aware as well that those things aren't disappearing. All of these natural other diseases and things that are coming up aren't just disappearing. It's people aren't calling or aren't reacting to them. So we really want to get information and research out there to show people that they're okay to go into hospitals, they're okay to call and to have those conversations. So that's one of the big things. We're pushing a lot of information and just research out there to help people kind of open up and feel comfortable with doing that. So that's one big piece as well. We're aligning ourselves with a lot of organizations and health experts. We have a CEO roundtable that has some of the biggest Fortune companies in the U.S. right now and nationally and internationally. And we're convening on a weekly basis to talk about what are best practices, what can we do, who can we align ourselves with to back some of these things that are going and creating PPEs, putting together guidelines for hospital workers to not only use education and use them properly, but compiling that all in one central location. So I do encourage everyone to check out the Heart Association's homepage at heart.org. We have a lot of resources right on there that are talking through everything I'm mentioning right now, but also just other resources that we have available, whether that's something that's for healthcare workers, for individuals like myself. I have a 5-month-old that's here at home. I apologize if there's any yelling in the background, but some of the resources we have on there are great. Just cooking classes. We have a virtual story time where you can pull your kids in. A quick little 15, 20-minute time that you can kind of bring everyone together, workout classes, things like that. So I really do encourage everyone to check out our website and see everything that we're doing. I couldn't cover everything that possibly in the short amount of time. I don't want to take up all the time here, but the Heart Association is doing some wonderful things to kind of help support organizations like yourself. So
That's great. Thanks, Adam. And since you're the workplace health lead, we're really excited to have you talk a little bit about some of the specific resources that AHA has to support workplaces in general and specific to COVID-19. So can you tell us a little bit more about those?
Absolutely. And I kind of spilled a little bit of that already with some of the resources that we have. We have a lot of healthy living resources that are on there. So healthy cooking recipes, working under cooking skills. How do I include family members? How do I use some of these or get these dietary things, these resources to my home? How do I make that applicable for where I am and food deserts, things like that. A lot of resources out there just on our website that are free. Some other pieces that we're adding is if anyone on here is a participant in our Workplace Health Achievement Index. It's a self-assessment. It's an organizational self-assessment that actually helps an organization really evaluate both their workforce and the workplace. So really answering some questions about how good or how well is our workplace wellness program being put together. We're adding questions to that, on emergency responses. And I think now more than ever is a time to truly take a step back and evaluate what we have in place, because some of the policies, our new norm is not going to be the norm anymore. So as we're building out these policies that we've been discussing, what do we have in place already? Let's evaluate that. Maybe let's, not recreate the wheel. Let's look at what we have in place and just adjust, make small little changes and see what we can do from there. That's a free resource that sits on our website. It takes maybe an hour or so to complete. It's a very great tool. I'm more than happy to talk in more detail about that, but it really helps evaluate a wellness program. And on top of that too, being in workplace health, we have obviously on-site screenings, things like that, or biometric screenings that are being pushed off or being canceled outright, which to me it's unfortunate, because at times like this, our wellness and our heart health and those aspects kind of get pushed to the side, and we're looking at a lot of safety pieces, which we should, absolutely. But that heart health, that mental health, all that other things are going to start to kind of pop up after we start to kind of get back into that norm. So we don't want people to just ignore it. We want to adapt and overcome and adjust. And with that, we actually have an at-home test kit that we have available. So for all the individuals that would be participating in an on-site screening, we actually can send all those supplies to an individual's home for them to perform a self-administered test. Send that back into us. We have a platform that gets uploaded into. They can view their own scores, get some healthy resources that I mentioned earlier. Everything's kind of tied together there. So we're kind of adapting our own resources as we currently have, as they currently are. And then some of those other pieces too that I kind of mentioned earlier with those virtual workout classes and the cooking class and things like that.
That's great. Thanks, Adam. And I'll be sending out some of those resources that you mentioned specific to workplaces after this call. So thank you so much for mentioning those. That concludes our panel portion of today's meeting. So we'll go ahead and transition to the question and answer section. So at this time, please feel free to continue putting any questions you might have for our panelists into the chat box. But we'll start with a question for Krinda. So Krinda, we know that there seems to be a lot of anxiety right now at different levels. What are some recommendations that you have or things that you're doing with your companies to help staff transition back into offices?
Yeah, I think that's an understatement to say there's a lot of anxiety. I read something yesterday and it's become about my favorite mantra. We are not all in the same boat. We are all in the same storm, right? So I think it's important as business owners to recognize that everybody has different stressors. There's different things going on. You see Luther's team at Central Bank working harder than they've ever worked, 14-hour days, 16-hour days. And so you see other companies struggling and they feel shipwrecked and they probably are hoping and wishing they were working 14-hour days. So, it's all about that different boat. And I think being aware and sensitive to each person's trials and tribulations that they're going through right now. So I'm very one-on-one. Now, my company's smaller, so larger companies will have to disseminate this out their managers most likely, but I'm very one-on-one with my company. So not one size fits all right now. Some are working from home. Some want to come in and take that one office day and work in the office and be the only person in there. but they need to come in and be a part of something, right? So we're just taking it case by case basis and making accommodations where we can. We're doing shortened work weeks so people have a day at home that they don't have to check email. They don't have to answer text messages. They don't have to do Zoom meetings. They can focus on their family, their pets, their house, or they can just focus on themselves, work out, go take a walk. So I think that's the biggest thing that we're trying to do is be very sensitive to each individual's needs as we start to enter back in, because I'll tell you what I've seen, and I'm sure you have as well, the amount of fear and anxiety to enter back into real life, normal life, is probably greater than when we got thrown home and said, stay home, we're going to shut everything down. I think the fear and anxiety is high, and it probably will continue to be so for months.
Thanks so much, Krinda. Dr. Greer, we've been hearing a lot lately about antibody immunity treatments. So can you explain this concept a little bit? And is this something that would be used to create a vaccine?
So antibody treatments versus testing versus point of care, point of collection. Vast amount of information out there. So I'll kind of go through some of the definitions that you might hear. There's point of collection testing, which is in essence, kind of generally think of the nasal swabs or that you get for the flu test, where they go back and they go nasopharyngeal and try to swab either your nose or your throat, et cetera. That's point of collection. That usually takes some time to get the results back. Typically they'll draw it, they'll send it off to the lab. It can be 2 or 3 days before you get that result back. So that's point of collection. Point of care is actually where they will take your sample, whatever that is, and test immediately or near time immediately with whether you potentially have an exposure or not, or whether you're shedding virus. And antibody testing is really looking at what antibodies has your body developed that has in essence been exposed to or potentially exposed to this to COVID. So if you haven't had any exposure, then you're not going to obviously develop antibodies to a negative. Once you have an exposure to this illness, then your body usually takes around 10 to 14 days for you to develop a strong enough sense or strong enough capability of immunity to be able to mount a protective factor. And that's generally consistent across all your different infectious diseases. Now, the testing and stuff that they're doing when they're looking at that is kind of all over the place right now. And unfortunately, not for probably another year will we have enough data to really say what is effective and what's not effective. Some are really good, but we all have to, as a business and a person on the individual level, realize there's a lot of false positives and false negatives. So a false positive means, in essence, you haven't been exposed, but it is showing that you have the antibodies to it. When you really don't. False negative is when you don't have your antibodies. And so you could either have comfort on either one of those. False positive, yes, I have it, I'm immune, it's not an issue, when in reality, that's not the case. And then false negative is obviously the flip of that story. So I would tell everyone to take advantage of the studies that are out there so you can have the testing, but you have to understand that it's so new that we just have to be careful with the results of that and understand that it might not be accurate until we can develop a better system and we can get the data behind it. And that's just going to take time.
That's great. Thank you, Dr. Greer. Karen, this next question's for you. We know that people are worried right now because they may be out of work or furloughed or have lost paychecks. So does Commonwealth Credit Union have any special programs that you guys are offering people right now who might be having financial difficulties as a result of COVID-19?
Yes, we do, and I'm very proud to talk about those. We are offering a $5,000 loan for a 36-month term at 3%, and there's no payment due for 90 days. So that's one way. We've committed $5 million to that. And then we're also offering on all our commercial, consumer, and mortgage loans, payment deferral for 90 days for those that qualify. So those are two things we're really doing that are helping our members. And then we're also out in the community feeding first responders. So police officers, sheriff's office, EMT, and even the people that are in schools preparing food to take out in buses to school children. We are using local caterers and restaurants that are struggling right now to provide meals for all those people. So thus far, I think we have spent about $50,000 for that in our communities. So we're very, very proud of that as well.
Yeah, you should be. Thanks so much, Karen, for all that you guys are doing to help support the Lexington community right now. It's just really impactful and means the world.
Thanks.
So thank you. Krinda, we know that people have fears about too much screen time in general, but specifically as it relates to COVID-19 being on the computer and just technology seemingly all the time, what can people do to prevent draining of energy from all that screen time?
Well, that's probably a difficult question to answer because I think we have a lot of screen time in general, right? So it's things like scheduling in and planning for breaks. So I teach aerobics at a couple of gyms, and so I'm still teaching for my students on Zoom. And then we just all get together and we have a scheduled time and we get a little bit of interaction, and then we do our workouts. So yeah, it's still some screen time, but I'm getting those endorphins, and endorphins make people happy, and happy people don't kill their husbands is my tagline there. So anyway, but taking those scheduled breaks, getting up and walking outside, take your dog for a walk, but you're going to have to do it very intentionally and very much on purpose, or before you know it, it's 5 o'clock, you've barely moved from the chair, and you just feel so glued to your computer screen and so disconnected from life that it's quite overwhelming. So I think it has to be very intentional right now in everything you do, and that also means taking a break for yourself, giving yourself grace, and taking that time to recharge. I
think that might have been a Legally Blonde reference, so I'm really proud that you plugged that in there.
That is my tagline that I stole from Legally Blonde. Yes, you're right, but
I love it. It's so true to this time. So thank you for your comments on that. Adam, can you talk a little bit about our workplace health solutions as it relates to Life Simple 7 and how all of those things and focusing on Life Simple 7 right now can help employees at workplaces to stay healthy?
Yeah, absolutely. So Life Simple 7 is basically the 7 metrics that we look at that are controllable metrics that have the biggest weights when looking at cardiovascular disease. So that's what all of our resources are grounded in, is looking at those 7 metrics. And how that really helps is kind of some of the pieces I've already mentioned, is breaking it down into simple little digestible pieces, not trying to, conquer the world at once, looking at one individual metric basically at a time. They're all connected. So as we focus on these little pieces, on diet, on making sure we're getting outside, getting fresh air, not sitting in front of a computer screen all day, and building our schedules around not only work, but our work-life balance and all of those other things, because mental health goes in a long piece of that as well, or a big piece of that as well. So focusing on those 7 metrics is an easier way to really kind of approach overall health, and also cardiovascular health, but overall health as well.
That's great. Thanks, Adam. And you can learn more about Life Simple 7 and some of the resources that I'm going to send out after this meeting around workplace health. So I don't think we have any other questions going through the chat box right now. So I'll just ask for closing thoughts from our panelists. Do you guys have anything that you want to add just to help people during this time?
So I'll go real quick. One thing that I forgot to mention earlier, sorry about that, is one thing we are developing is we're hearing from organizations and community partners, people that we're working with, and building out webinar series. So kind of in tandem with these community conversations. For example, on May 11th, A couple weeks away, we actually have our CMO, Dr. Eduardo Sanchez, and Johnson & Johnson, who's also a member of our CEO Roundtable that I mentioned earlier. They're actually hosting a mental health webinar, kind of talking about getting people back into the workplace. I know we kind of talked about that anxiety and getting people back in there. So that's what that webinar is going to be focused on, is just having those conversations. How do we start to approach this? And we're building out that webinar series. So the things that you guys are wanting and needing as organizations, please by all means reach out to individuals like myself or Natalie or anyone else that you have contact with at the Heart Association, because we're passing those along and when we're developing webinar and educational series off of that information.
So I'll say something, Natalie. In a financial institution, trust is so important. And as we prepare to come back in the workforce with our staff and as well as members coming into our lobbies, I think knowing that we are doing everything we can to keep them safe is so important, and that we are supporting and communicating that to our staff. They have to feel safe and secure to come back. And that's one thing that we're concentrating on. And the same thing is true for our members that walk in the buildings. We're going to communicate very well that we are a safe place for them to come and do their business.
I'll hop in. And this is really just to reiterate a point that I made earlier, because the thing that I've read so far that resonated with me the most was, again, back to that ship. We're all in the same storm, but my journey, my experience is going to be different than someone else's. And I just think during this time to remember that everybody's stress is relative. And even if it seems like, well, gosh, I wish I were you because your job's totally safe and secure and you've got nothing to worry about, they probably have other things to worry about, right? So just remembering that everybody is unique, and be kind. That's it.
Yeah, and then I'll just cap it out with, just what Brenda said, bringing this down to the individual, helping them understand, as well as Karen and Adam, helping them understand the situation, giving them the tools that's necessary so that they can work through that, having grace and mercy for the stressful events that they're going through, and really the mental health. And finally, then also, there are other medical conditions besides just COVID. Wrapping all of those up and having that grace and mercy to understand that, hey, let's give this to other individuals, because we ultimately might need it in the future as well, to work through this stuff so that we can get on the other side and continue to work through these issues. And when something else comes up in the future, we've developed, from lessons learned, a better approach.
Mm-hmm. That's great. Thank you all so much for those closing thoughts. And we'll transition to the end of our time together. And just thank you so much in closing to our panelists again and our attendees. And a big thank you to all the healthcare teams across our region. We know that your dedication and focus on the health of our communities is inspiring and really helping to save lives here in Lexington. We know that doctors, nurses, healthcare workers, first responders, grocery store employees, the list goes on and on. You guys are working tirelessly and selflessly through all of COVID-19, and we just want to thank you from the bottom of our hearts. Second, I want to mention some of the upcoming events that we have at the Heart Association. So I'm sure most of you are aware that we have transitioned our Heart Walk next week on Saturday, May 9th to a virtual event. It's going to be really, really fun and interactive. And one of the big perks is that you're able to walk from wherever you are and however far you wish. So I'll be sending out some information in an email about how to register for that later this afternoon. And then our next community conversation that's going to be around building healthy communities and homes during COVID-19 is going to be on Friday, May 15th at noon. So you'll get another calendar invitation and information for attending that Zoom call here in the next few weeks. And then on that call, we're going to have a few local experts on a panel discussion, much like today. But we're also going to be hearing from a local mindfulness expert whose name is Dr. John Patterson. He's with Mind Body Studio here in Lexington, and he's going to be walking us through the many different benefits of practicing mindfulness. And he's also going to lead us through a short mindfulness activity that we can all use in our daily lives. So really looking forward to that time together on May 15th. Last, I just want to thank the listeners one more time, and we'll email all the resources that we've discussed here today as a group. And we look forward to communicating with you guys in the future in our next community conversation in our series. And we really appreciate your feedback, and please keep sending us any needs that you might have throughout COVID-19. So thank you all again, and please stay well during this time.
Thank you all.